Hi there, Dr. Jess here from Premier Physical Therapy, and I am going to be talking to you today about why is it so important for us to get back to leading an active lifestyle, especially after recovering from breast cancer. Very short answer, is this important? Yeah, it's really important, and I'm about to explain why. So here's a little schematic that's going to kind of bring you through the steps. So first, we want to completely recover from breast cancer. And this is something that I'm constantly pushing. And I have people ask me the question, well, why? Why is it such a big deal for me to be able to get back to going for a long walk? I mean, I'm fine. I sit on my couch and I'm okay. And I'm not really in that much pain anymore. Well, the answer for that, okay, is you are missing out on so much of the health benefit that you can get from returning to an active lifestyle. And I don't want that for anybody. I really want everybody to be able to achieve all of these health benefits. Okay. So, if you're able to return to cardiovascular exercise, so meaning that you're able to elevate your heart rate and keep it elevated for ideally at least 30 minutes, which could be anything: walking, running, biking, hiking, climbing, canoeing, kayaking, it doesn't matter, anything. Um, as long as your heart rate is elevated, then you're going to get these health benefits. So it's huge and it's free. It's free to do, which is great. And what it's going to lead to is it's going to allow you to improve your aerobic activity. It's going to improve your stamina, improve your fitness, can help to improve your mood, help to maintain a healthy weight. It can help you to manage your current health conditions as well as prevent future health conditions, which ultimately helps you to live independent for a longer period of time and may even help you live longer. So, why would I not want all of these for every single one of my patients? I mean, this is only good news. All right, now let's go into some specifics for each of these topics. So, increasing your stamina, fitness, and strength. Now, why do you want that? Well, let's say you want to go on a vacation with your family. And in order to participate fully, and maybe it's a cruise and you're going to get off the boat and you've got to be able to walk around this town and be able to go see historical sites, things like that. Well, you might be like, I haven't walked for 30 minutes in years. Maybe I won't go on this trip. It's like that, you don't want that. You always want to be able to keep up and participate and enjoy your friends and enjoy your family and not have things that you're questioning, like maybe I can, maybe I can't. So you always want to try and keep up that stamina. Also, it's just going to be healthy for your heart and lung fitness, and you're going to have overall improved bone and muscle strength over time. It doesn't happen right away, okay? This is something that builds up with continued participation. All right, keeping excess pounds at bay. Well, overall, if you lead a healthy lifestyle, your body will more easily find that healthy set point, which will help you to have your clothes fit a little bit better, you move a little bit easier, and it decreases your risk of metabolic diseases, type 2 diabetes, all that kind of stuff. Other things it can do, it helps to manage chronic conditions. There's a lot of people in this country that are on multiple medications to manage chronic conditions. Every time that you're on multiple medications, there could be a risk of side effects, interactions with medications, things like that. So, the better you're able to manage those health conditions without as much use of medication, then you're going to decrease the risk of potential side effects, things like that. Okay. um, Chronic conditions that it can help with: diabetes. You can help with some types of cancers, heart disease. A lot of these conditions really do benefit from individuals participating in cardiovascular exercise. Now, let's say you don't have these conditions and you don't want these conditions, okay? So, participating in regular exercise also helps to decrease your risk of becoming obese, decrease your risk of heart disease, hypertension, type 2 diabetes, metabolic syndrome, stroke, certain types of cancer, and osteoporosis. So, if we can prevent these from happening simply by leading an active lifestyle, that's awesome. All right, what else can it do? It can strengthen your heart. So when you become cardiovascularly fit, your heart doesn't have to beat as fast as it normally would. It starts beating more efficiently and it can improve blood flow throughout your body. All right. It also helps to keep your arteries clear. So by helping to boost your good cholesterol HDLs and lower your bad cholesterol the LDLs, then you can result in less buildup of plaque in your arteries, which may help to reduce your risk of cardiovascular disease, stroke, all things that are they're good for you. All right, it can help to boost your mood. When you exercise, you actually get a release of positive endorphins. So it can, like, say you're just having a day and you're kind of down, you've got a lot of stuff on your mind, going out and going for a walk, going for a run, all of a sudden you're like, man, like I can think more clearly, I feel a little bit better, I feel like I can manage my life stress a little bit better. It's like, okay, yeah, I can definitely, yeah, I can move forward now. I do that all the time. If I can't make up my mind about something, or something's on my mind and bothering me and I just can't put my finger on it, all I need to do typically is go out for a run, and then everything clears, my head clears, and I'm like, oh yeah, this is why I'm frustrated about this or that. And then I can get to the answer a lot faster. Okay, it can help to reduce the tension that's associated with anxiety, and then it can also help to improve your sleep. So what I'm not saying is that if you're clinically depressed and on medication, that simply going for a walk will replace medication. Okay, I'm not saying that at all, but it can help you if you're clinically depressed to decrease the burden that the person plays on your day-to-day life. Okay, so but I'm not saying it reduces or even gets you off of medication. That's outside of my scope. Okay, hot topic right now, viral illnesses. So the healthier you are and the healthier your immune system is, the better your body is able to attack and not have viruses, small viruses, really get you down. Okay, so that's not saying that you are completely immune by any means, but your body is better able to fight off potential illness. Big topic with a lot of individuals, okay, is being able to stay independent as you age. What does this mean? It means being able to keep your muscles strong, and keeping up the stamina means that you can stay in your home for longer periods. You can manage that home. You can manage the yard. You can decrease your risk of falling, okay? You can keep your mind sharp, and it can also help to prevent onset of cognitive dysfunction such as dementia, and overall just improve your quality of life. Now, there have also been studies that have shown that people that participate in regular sustained activity or aerobic exercise do seem to live longer than individuals that don't. Now, you can see from the previous information that I've given that, well, if they have decreased risk of chronic conditions and are able to manage their conditions and have healthier heart and lung function and have decreased risk of falling, it seems like, well, yeah, that would make sense that these individuals would potentially live longer than somebody else. There's no guarantees in life, as we know, but we always are trying to increase our odds to have a long, healthy life. Now, what would this look like? Okay, how much cardiovascular exercise is recommended to achieve all of these benefits that I just talked about? Well, what we're looking for is 150 minutes a week of moderately intense exercise. Now, what does that mean? What is moderately intense? Well, what it means is that your heart is elevated, so you're breathing a little bit harder, but you're still able to sustain a conversation. So you're not breathing so hard that you're gasping for air, okay? You don't need to exercise that hard to achieve the health benefits, okay? Now, you could do this in any sort of combination. You could do 5 days a week for 30 minutes. You could do 3 days a week for an hour, or any combination there in between. It really doesn't matter as long as you're doing a culmination of 150 minutes a week. Ideas for what this looks like: you could go out for a walk, a run, a bike, a rollerblade. I like rollerblading. I call it blading because it sounds cooler, but still, it's fun. You could swim. You could go canoeing, kayaking, dragon boating, participate in sports. It doesn't matter. As long as you're elevating your heart and having fun, that's what matters. All right. If you have any questions, concerns, if you're like, hey, I'm not really sure if I'm ready to get into this activity, I might be having pain or limitation or whatever it might be, there's a barrier. There's a barrier to you not leading this active lifestyle. Feel free to give us a call, shoot me an email. You can check out our website if you want to learn a little bit more information. And just the goal is to help to encourage everybody to get out there and stay healthy, and be advocates for other people in your life as well. You know, say, hey, why don't you come out with me for a run or for a walk? It's always more fun to go with somebody. So let's do this together as a community. All right, so stay tuned for more information next week.